This podcast is for informational and educational purposes only. It is not medical care or advice. Clinicians should rely on their own medical judgments when advising their patients. Patients in need of medical care should consult their personal care provider. Welcome to That's Pediatrics, where we sit down with physicians, scientists, and experts to discuss the latest discoveries and innovations in pediatric healthcare.
Hi, I'm Allie Williams. I'm one of the pediatric hospitalists here at UPMC Children's Hospital of Pittsburgh.
I'm Samir Agnihotri. I'm a researcher here at Children's Hospital.
And we are today joined by Dr. Diego Chaves-Gnecco, who is the director and founder of the Salud Para Niños. Sorry, I always say that wrong for some reason, but thank you so much for being here.
Thank you so much for having me.
We hear that there's an exciting celebration coming up for your clinic.
Yes, we're celebrating a benchmark this year. It's the 20th anniversary since the creation of Salud Para Niños. 20 años, 20 years since we created Health for the Children. Salud Para Niños actually is an acronym that Salud stands for students, residents, faculty, and Latinos United Against Health Disparities. So one of our main goals is to address health disparities. So Health for the Children, 20 years at Children's Hospital of Pittsburgh.
That's fantastic. Can you tell us a bit more about the history, the journey, and the development of this amazing program?
Yes, so I'm originally from Colombia, and I came to Pittsburgh, believe it or not, 24 years ago, just for 1 year. I was a pediatrician in Colombia, and I came to do a fellowship, and opportunities started to show up. I was offered to stay for my MPH. I was offered to finish some research that I was doing in the fellowship. And after those decisions came up, the next logical step was to do my residency again in pediatrics. So I applied for the match. I was fortunate enough to match in one of the best hospitals in the country, Children's Hospital of Pittsburgh. And once I matched, the residency program has to up-to-date a program that is called CORE, Community-Oriented Residency Education. And this program is focused in training our future generation of pediatricians in providing health for minority and underserved populations. So the director of the residency program at that time was Dr. Dina Hofkosh. She approached all the applicants, all the residents who had been accepted for the residency program and were interested in CORE. And she actually told us, we have good news. There is 4 of you guys who are interested, but we only have two spots for clinic rotations. So we can be creative, or we can just choose 2 of you. And the 4 of us, we said, well, let's be creative. So Dr. Hofkosh, who has been amazing throughout the last 20 years, supportive mentor, she actually came to me and offered me if I wanted to do my continuity clinic in what it's called today is the Child Advocacy Center. So it was for foster care kids. And I said, I would love to work for kids who are in foster care. I think there is a lot that we can be done about that. But you ask us to be creative. And as part of being creative, by then I had been in Pittsburgh for 4 years. And I had realized that the Latino community was an invisible community. So even up to this day, this is one of the things that is going to still break my heart. 20 years later, you go on the streets and you ask, are there Latinos in Pittsburgh? And you hear there are no Latinos in Pittsburgh. And the truth is that there are. We're 45,000 Latinos in southwestern Pennsylvania, in the 7-county area. And as a community, we need services. So back in 2002, I proposed to a residency program, and I proposed to the hospital to create Salud Para Niños. The initial idea of the program was to have my continuity clinic as a clinic, not exclusive, but as a clinic that could serve Latino patients. So we started slowly. It was 1, 2, 3 patients here and there on a weekly basis. It was on Tuesday afternoon. But after the first year that it ran as a pilot project, it was clear that the need was there. So the program quickly grew up and expanded. So then we started going to the Birmingham clinic, where we offer, now with the Care Mobile, a free clinic for uninsured patients. And over the last 20 years, the program has continued growing. So now we have 3 weekly clinics in Oakland for children who have insurance. We see patients on Tuesday afternoons, Thursday mornings, and Friday mornings. And then coincidentally, right before the pandemic happened, we expanded our free clinics because the need was so big, and we were able to demonstrate through another pilot project that we needed to have more clinics for uninsured patients. So now we're offering weekly clinic on Tuesday mornings for uninsured patients. We bring the Care Mobile from Children's Hospital of Pittsburgh to Beachview. We partner with a local NGO, Casa San Jose, and we're seeing many kids who don't have health insurance. Despite the pandemic, 2020 was a record year where we saw and we provided the most visits for uninsured patients. 2021 already surpassed 2020, and in 2022 we are on target to surpass the numbers of patients that we saw in 2021. So it's been a very successful program. I'm very pleased to share this with everybody, and we try to focus on a comprehensive care. So it's more than seeing the sick kids. Of course, it's providing well child care visits, but it's making a difference in the community. So putting a lot of emphasis in injury prevention and in many of the things that we do as pediatricians, advocate for those who cannot speak for themselves.
Yeah.
It's a huge growth of the patient population that you're seeing as well. Are there still residents involved, or what type of providers do you have through the clinic?
Yes, so our program has been supported throughout the years with volunteer opportunities, and we are very grateful to all the volunteers that over the last 20 years have helped us at many levels. We have had high school students, we have had college students, and we have physicians at many levels as well, from internship, residency, fellows, and then faculty. But with the expansion of the clinic for uninsured patients, the one thing that we're offering in partnership with the residency program is a continuity clinic for residents who are interested in doing their continuity clinic with us. So we have now 3 residents, and then the feedback that we have received for them is that they are very pleased and very happy with the experience, and they come with us on Tuesday mornings. Every Tuesday is a different resident, but we have 3 constant residents who have done it so far, and the feedback that we have received from them is amazing. And I'm pleased to share that one of those 3 residents actually was selected as a chief resident for our program. And one of the things that she said in the interview, I hope I'm not breaking any rules by sharing this with everybody, but one of the things that she said in the interview is that she was so happy with her continuity clinic with us that she wanted to continue with this program, and she wanted to make sure that it was available for all future generations of residents. And I'm pleased to that because we have many missions. We have the mission to make a difference in the community, to provide help for our patients, but also one of our missions is to train the next generation who are going to be providing for Latino children, not only in Pittsburgh, but around the country and around the world.
Do you have to be bilingual as a provider to help serve the clinic?
So we prefer if people speak another language and if they are fluent. However, I will tell you, one of our residents come and she's trying to increase her skills, and she uses the interpretation services, and that's completely fine. And then the other thing is that we're seeing patients who come from many countries, so obviously Spanish is the main language that we use. But for example, we have a lot of families that are coming from Brazil, so I don't speak Portuguese. I joke that I speak Portuñol, but obviously we need to provide the best care, so we use interpretation systems whenever it's needed. And the truth is that while our program was focused on the Latino community, over the last 20 years that we have seen so many families who come all around the world who don't have health insurance in the Pittsburgh area. So we have seen families from Denmark, from South Korea, from Japan, from Indonesia, which I don't know how they hear about us, but they hear that we provide excellent care, free care, and they come when they need it, and we're pleased to do it for them.
Right. So to elaborate on that, Dr. Diego, how can we help, or how can your listeners today help increase awareness? And do you encounter problems in terms of resources or funding, things like that?
Yes, so I really appreciate that question. So the first thing is, I want everybody to know that there are Latinos here in Pittsburgh. We cannot do anything for somebody that we don't know that they exist. And as I mentioned before, we as pediatricians always have been known to be the voice for those who cannot talk. So as pediatricians, we speak for children. They cannot talk by themselves, they don't vote, they don't have always a seat on the table. And the same thing happened with the Latino community. Many of the Latino members of the community, they don't speak English, therefore they don't have a voice, they cannot vote. So we want a voice to be a voice for them. We want to be here, we want to know that we exist here and that we have a representation. So as I mentioned before, there is 45,000 Latinos in southwestern Pennsylvania. 15,000 of them are children of the age of 18. So that's the first step. Things that we can do in terms of advocacy, and this is not only specific about Latinos, but in Pennsylvania there are 24,000 children who don't have health insurance, and they won't qualify for any of the options of insurance. They won't qualify for Medicaid. They don't qualify for CHIP. There is an organization that is called Children's First, and they are advocating in Harrisburg, and UPMC actually is a sponsor of this to make sure that the laws are changed so all children have healthcare in Pennsylvania, that we truly have universal healthcare in Pennsylvania. Right now, as I mentioned before, there are 24,000 children who will never have health insurance in Pennsylvania, and these are not only Latinos. So that's the first thing. Can we advocate to the authorities, to Harrisburg, to make that change in the legislation? And let me tell you, this is nothing that is so new or so different that other states are doing. The states like Illinois, New York, California, Massachusetts, they truly have universal health care, and they have universal health care for all their children in those states. And actually it's sad because we have children who come, for example, from Massachusetts, who had been receiving amazing care from their local children's hospitals, and they come here, and unfortunately, their care that they have is very limited. I just had a patient with a cochlear implant who got the cochlear implant in Massachusetts. They didn't have any alternative for health insurance there. the hospital provided for them. Here, unfortunately, we cannot even do the controls of those cochlear implants. I had a kid as well from Massachusetts with a congenital heart disease. They had the surgery in Boston. They brought everything through their insurance programs. Here, what we can do for those kids is very limited. The free care that we provide with the well-child care visits, the immunizations, but we have limitations when it comes to see specialists. So we are working with many here at Children's Hospital of Pittsburgh to see how can we provide specialty care for the children. I have been in contact with pediatric cardiology, with pediatric endocrinology, with pediatric ophthalmology, and I have to say they have been very supportive, but we're looking forward to be able to grow this and to provide this. And again, the solution will be to have true universal health insurance for all of our children in Pennsylvania, not only in Pittsburgh, in Pennsylvania. Our program, since the beginning, for the last 20 years, had been a program that had been run without a specific budget. So we run on volunteer basis. So the work of the volunteers, the work of the residents is very important for us. But we also need some other support. Right now, we only, for example, have one person who's helping to answer our Spanish line. By the way, our Spanish line was the first line in Pittsburgh to answer to give an option for other languages. So when people call the primary care center, the 412-692-6000 number, there is an option in Spanish, option 8. And we were the first ones to have that. The hospital now is doing an amazing job that when you call the main number of the hospital, you have different options in the menu to choose different language if you don't speak English. And that's great, and we should replicate that in many other clinics, in all the children community pediatric clinics, in our clinic in the primary care center. But we need more bilingual staff. We need staff who speak different language. If we don't have that staff, we rely on interpretation systems, which is okay. But ideally, we want to have a staff who are bilingual. So right now, I'm going to make a pledge here, and I'm going to do an advertisement. I hope I don't get charged. But we are hiring. We are looking for patient representatives who help us with answering the phones. They don't have to be bilingual, but if they are bilingual, it's a benefit. And we're also trying to hire nursing staff, medical assistants, and nurses who can help us with caring for our patients.
I've noticed as a hospitalist here that there is a huge difference when you speak the language versus use the interpretation system. And so I understand the importance of having that bilingual, face and aspect of your clinic. As someone who studied in Miami, hablo un poquito español, so my Spanish is not as great as I would like it to be. Do you have recommendations for providers who would like to increase their medical Spanish dictionary so that they can potentially help with this clinic in the future?
Thank you, Ali, for that question. Actually, your Spanish is lovely. I think we need to encourage the more languages that we speak, the better. In this country, the main language is English, and we all have to speak English. But I joke, this is as good as it gets after 50 years. So it's not easy, it's not overnight. And we need to make sure that our families who don't speak English learn how to speak English. But we, as a country, and as Americans, we need to be looking into speaking other languages. The world is bilingual, trilingual, multilingual. So if people want to learn another language, I encourage them to do it. I would love to speak more than 2 languages. I speak English and Spanish, but if I can speak Portuguese, or if I can speak French, it will be ideal for me. In terms of Spanish, the more exposure that you get, the better. So, volunteering in our clinics is an opportunity. Working with our patients is an opportunity. Listen to the media that is available in other languages. There are many resources. The American Academy of Pediatrics has a very good resources, a small dictionary for medical Spanish, which I think is great. It has the main terms. The School of Medicine for medical students, they offer an elective on medical Spanish for first and second years. And then what we offer as a third and fourth years is also an elective for those students to come and work with us and continue improving their Spanish and practice their Spanish. So any opportunity that you can take to learn a language, the more the better. I will say I learned my English by taking many classes, by being exposed, but the best was the environment. So actually I learned my English going to a summer camp. So any immersion program, any opportunity to get exposed to the language, the more the better.
Hey, Dr. Diego, you're truly inspiring and very passionate, and what you've built with your team is amazing. What would you like to see we're celebrating the 20 years. What would you like to see this program become in the next 20?
So, when we started the program, I said one of our goals is to address disparities in healthcare. So ideally, we want to address disparities for all children, not only for Latino children, but many minorities in our country, many African-American families who are suffering from disparities. We have actually white kids who, because they come from underserviced areas, they don't have all the resources. So if we can address those barriers, that would be great. If we can debunk all those disparities, that would be the best. My dream and my goal as a pediatrician is to see that all those kids that I take care, not only they grow up healthy and that I address his and their current acute needs, but also that they grow up to become adults who contribute to the community. So every time I see one of my former patients coming to a clinic, I said, I want you to be my pediatrician. Or they share with me that they just graduated from high school. Many of them first generation graduating from high school or graduating from college. That's a way to celebrate. As a 20-year event march, what a lovely present will be to know that Harrisburg has changed the laws and we do have universal health insurance in Pennsylvania. I don't know if that's realistic, but we can only dream. And also to get the support of the hospital. I really appreciate you guys having me here and all the people who are listening to this, because we need to make sure that we treat those who are invisible to our eyes. Mm-hmm. So it's, in this case, it's the Latino communities, but I know there are many other communities who are not receiving the care that they need and the support that they need. It's great to have one of the top hospitals in the country. We need to make sure that our hospital is available for all who need it, all who lives in Pittsburgh and in southwestern Pennsylvania.
Yeah, we are so lucky here in Pittsburgh that we have a lot of these opportunities, and we have a hospital that's filled with great specialists here. You had mentioned that not only are there, the population of Latinos here in Pittsburgh, but there's that in southwestern Pennsylvania is actually a larger number than even I realized. Mm-hmm. Are there other clinics that Salud Para Niños interfaces with in other areas of southwestern Pennsylvania, or is there plans for expansion for your clinic in those areas?
So we continue growing, and the idea is to continue providing as much as we need. I mentioned the opportunity that there are to expand our service to subspecialty clinics. When we started, we were the first bilingual bicultural clinic in southwestern Pennsylvania. Right now, there are many other places that care is being provided through federal qualified centers, and that's great. There are many partnerships that are being built, and that's great. And as I said before, it's beyond southwestern Pennsylvania. We also are looking, I know UPMC has a lot of interest, and they're working very hard in the entire region to meet Pennsylvania, to Harrisburg, and even outside of a state, places like Western Maryland. So, this is something that we have to look in the broader spectrum of the plan, because UPMC is going to be providing for Latinos in many areas. And while here in Pittsburgh, sometimes we are invisible, in other places the relevance of the community is much more important, like in Harrisburg, in Philadelphia. So, we need to prepare ourselves and work in that regard.
If you would have one takeaway, I feel like you've hit a lot of really important points throughout this, but I always like to kind of end and wrap up with one big takeaway that our listeners can get from hearing all about your amazing work with the clinic.
Yeah.
So I choose to be a pediatrician perhaps for one or two reasons. The first one is because I realized that in one small encounter of 20 minutes, 30 minutes on a well child care visit, you can make a huge difference to a family or to a child. You can smile to our child. You can model to those families the importance of early literacy. You can encourage those moms who are sometimes hesitant because it's their first child and they don't know how they're doing. So as a pediatricians, we're privileged that we can make a huge impact with little that we do in the children's life and in the families that we treat. So I encourage the next generation to think about this. The other reason that I choose to be a pediatrician is because of the advocacy that we do. So I have been mentioning throughout this presentation the importance that we come the voice that cannot, for those who cannot speak for themselves. So we as pediatricians, we do it all the time. I mentioned already that children don't vote, that sometimes they don't can speak or advocate for themselves. We need to be their voice. But we also need to be the voice for those who cannot speak for themselves for other reasons. So there are many minority communities, people who are immigrants, Latino families, African American families, white families who come from underserved areas that they don't have the access and the privilege that many of our families who live in the city have. So we need to be those advocates. We need to make a difference in those families. And we can do it in small amounts, just in 20 minutes, 30-minute visit or well child care visit, doing an encouragement to those families, modeling early reading, doing some injury prevention, and then at the advocacy level, at the local and at the regional, at the national level, we also have a role and a voice on that.
Great. Dr. Diego, are there any websites or social media or anything you'd like to share for the audience so they can get more information?
Thank you. So we have our webpage through Children's Hospital of Pittsburgh, www.chp.edu Spanish Clinic. We also are in the Department of Pediatrics, University of Pittsburgh Department of Pediatrics, Salud Para Niños. We also have a Facebook page, Salud Para Niños. And I have a personal Twitter account that is more for scientific purposes, sometimes publications and things that we do. But all the information for the community is in our social media and in the website.
Well, thank you so much for being here. Thank you for celebrating this important anniversary with us and sharing great information with us. We truly appreciate you coming in today.
Yes. Thank you so much for having me. Thank you for having me. It's a true honor. And I feel privileged and I feel honored to be part of Children's Hospital of Pittsburgh over the last 20 years. It's a big celebration. I am very happy and I'm very grateful to be able to celebrate with you guys. So thank you so much.
Thank you all for listening and have a great day. This is That's Pediatrics.
You can find other episodes of That's Pediatrics on Apple Podcasts, Google Podcasts, Spotify, and YouTube. For more information about this podcast or our guests, please visit chp.edu/that'spediatrics. If you've enjoyed this episode, please be sure to rate, review, and subscribe to keep up with our new content. You can also email us at podcast.upmc@gmail.com with any feedback or ideas for topics you'd like our experts to cover on future episodes. Thank you again for listening to That's Pediatrics. Tune in next time.